Happy birthday, Dr. Bhagwan.
Thank you for your kind birthday wishes. Clinic Ang Singh was first incorporated in the 1st of July 1989. At that time, I was just passing by through Rawang town and I found that this is an area where the people need a clinic, and it was boisterous coming up town, but there were lack of basic facilities for the people. So that made me venture into this, and I decided to open my clinic, and we carried on from there. Basically, what we need is empathy and sympathy with patients. And end of the day, what happens is I find that those days in Rawang and even now, there are a lot of people who are from the lower or middle income group. All the time, whenever the small things come up, they used to be referred off to the hospitals, Hospital Slayang or Hospital KKB. The basic facilities were not there in most of the clinics which were already established at that time here. Hence, I decided to open a clinic for the sake of the patients where I can give affordable medical treatment to them. Slowly, as Rawang town opened up, became bigger, became more prosperous with a lot of industries coming in, we made changes in such a way that we had more facilities for the patients. For example, x-rays. It is very important to have an x-ray in an industrial area because when any small accident comes, and the most basic concern is whether we have broken bones or not. From x-rays, we came up with our basic simple blood test to know about other issues which are affecting patients. Subsequently, we went into ultrasound so that we can at least have ultrasound. Is not that we are going to be perfect in it, but it's just a guide to help us in what we can do further for the patient. Now, as time has gone by, we have definitely done a lot for the community, and at the same time, we intend to give back to the community. So much so that where we can, patients who are OKU or patients who come from nursing homes or old folks' homes, we give preferential treatment in the sense that either it is free of cost or at a very low cost rate. At the moment, we have even ventured into Yayasan Ipoh, which is an Ipoh, where we've opened a clinic for the patients who are having disabilities. They come there for physical therapy, physiotherapy, and rehab programs, but they have no medical attention as such. Hence, we teamed up with Dr. Ramanathan at Yayasan Ipoh, and we opened up a clinic for these patients and also for the patients from the surrounding areas in a very preferential rate where they don't have to rush all the way to other areas or bigger hospitals for treatment. In the coming year, as time has gone by, what we have done is we have improved our services in such a way that we have even gone into mobile audiometry services for factories in the surrounding areas whereby they cannot send the workers out to OHT centers for mobile audiometry. As such, with us having 6 occupational health doctors, we are really improving and progressing further. Mobile audiometry is needed because occupational health care is becoming of importance to people in Malaysia. DOSH is involved, and in that sense, we hope that our uh, catering for audiometry services will help out industries in the long run. End of the day, as I said, it is sympathy and empathy which is needed. So my concern will be that my children can carry on the legacy which I have started over here and carry on and continue what I am doing, give the best affordable treatment to patients. We have also indulged into dental care as my daughter-in-law is a dentist and we have opened up 2 dental branches. Hopefully, we will progress into that also. Well, to tell you the truth, I wouldn't be there if there were no patients. To me, the most important person in any clinic, firstly the nurses, then the patients, and lastly the doctor. If there are no patients and we have no empathy or sympathy, we won't be anywhere. So my gratitude to all my patients is that In whatever way I can repay you back, let me know, because it is you who made me where I am today.